British Columbia's bold move. The Canadian province plans a trial to decriminalize drugs. Will it reduce the number of overdoses or create a bigger public health crisis? I'm Andrea Sankey, and this is the Newsmakers. Since 2016, almost 30,000 Canadians have died from a drug overdose, and nearly a third were in British Columbia. But now the West Coast province is ready to try a less conventional solution.
As of January 31st, 2023, adults 18 and over in British Columbia will no longer be subject to criminal charges for the possession of up to 2.5 grams of certain illegal drugs for personal use, and the drugs will not be confiscated.
BC's trial will take place over 3 years, and it includes hard drugs like cocaine and methamphetamine. The policy shift has been welcomed by several Canadian public health officials, but others are not so sure. Some argue the approach will take the situation from bad to worse.
Alberta's government will never allow our communities to become sanctuaries for cartels and drug traffickers. This action will likely result in a dramatic increase in drug use, violence, trafficking, and addiction, something that health systems are already overburdened with.
Well, the opioid crisis is not exclusive to Canada. Its neighbor, the United States, is facing an even tougher fight. Just across the border, more than 1 million Americans have died from a drug overdose since 2001, over 100,000 last year alone. And the number of opioid-related deaths is rising too. In 2020, over 70,000 people died using drugs, including heroin and fentanyl. 12 months later, that number rose to more than 80,000. And it's not just the loss of life that's a problem. Since the U.S. started its so-called war on drugs, the number incarcerated for drug offenses has skyrocketed. In 1980, just under 41,000 Americans were imprisoned. By 2019, that number had risen to almost 500,000. One nation that might have the answer to the illicit drug crisis is Portugal. At one stage, an estimated 1% of the country's population was using heroin, and Portugal had the highest HIV infection rate in the European Union. But in 2001, the government in Lisbon took drastic action. The use and possession of drugs was completely decriminalized. Addicts were no longer treated like criminals, but instead as patients who needed help. And it worked. The crisis stabilized.
Well, I think what we can show about our Portuguese approach to drug users and the decriminalization of drug using is that it's doable, and it's not going to be the end of the world if you deal with it as an healthcare issue. The criminal system might not be the best suited system to deal with this sort of population, and the healthcare system is able to provide answers much more quickly and much more direct to the point of problems.
So is Canada on its way to achieving what Portugal has? And can the decriminalization approach work for other countries as well? Well, joining me now to debate that from Sydney is Antony Loewenstein, an investigative journalist and author of Pills, Powder, and Smoke Inside the Bloody War on Drugs. From Albuquerque, New Mexico, we have Michael Vigil, the former International Operation Chief for the U.S. Drug Enforcement Administration. And from Lisbon is Cristiana Merendeiro. She is a neuropsychologist and project manager at CRESCER, which advocated for Portugal to decriminalize drug use. Thanks all so much for being with us. Cristiana, let me start with you. With Portugal's 20 years of experience now, just tell us what's really worked and what also hasn't worked. And do you think it can be scaled across other countries, or is Portugal unique?
Well, hi everyone. Thank you so much for the opportunity to be here speaking with you. So just to be clear, Portugal decriminalized the possession and use of all drugs. So this means that in 2001, we decriminalized the drug use. So it has to be viewed as a health issue, not a criminal one. Drugs are still illegal, but to get caught with them until a certain amount means a small fine, or a referral to a treatment program. So Portugal's authorities don't arrest anyone found with a certain amount of drug. Instead, drug offenders receive a citation or are ordered to appear before a dissuasion panel made up of legal, social, psychological experts. So the perspective is to help people, not to criminalize them. But I want to highlight that the most important part that came along with this law was provided by a subsequent decree law that set the field for the development of a network of services and the implementation of important community-based and especially harm reduction-based responses for people who use drugs.
So you had, in other words, a lot of infrastructure to deal with this specifically, as you said, as a health issue, not as a criminal issue.
Yes, and this is what guarantee these positive changes and these advantages that came with this law.
Tell me quickly, is there anything you were disappointed in this experience, or did maybe its success even surprise you beyond what you were expecting? What's your overall feeling?
No, the overall feeling is that it was very positive to implement this law, but we want more right now. So I would say that we had a lot of advantages with that, with the spread of infectious diseases, drug-related deaths has decreased. People in very vulnerable situations are now connected with teams that respect them, that work in proximity with them, and considering them the experts of their own lives, and this is very important. Also, this harm reduction perspective went considerable beyond these syringes exchange programs, opioid substitution treatments, drug consumption rooms. So right now we are focusing people's needs, that is housing, that is employment, but we need to scale up the answers we have right now.
Okay, so many layers, and it is still a work in progress. But knowing what you know then from Portugal's experience, do you think this 3-year trial in British Columbia will actually succeed? I mean, is 3 years really enough to judge?
I think since the beginning it's important to set this network of services in place, because to decriminalize drugs for itself will not work. People need support. People need to to be connected to the services, to be respected. We need to develop a relationship, a proximity with these people that are in very vulnerable situations.
Okay. Michael, unless Cristiana has changed your mind in the last 3 minutes, you are pretty confident these decriminalization programs do not work. Why?
Well, here, let me first say that I agree with Cristiana in terms of implementing policies dealing with harm reduction. I don't believe in the incarceration of individuals that are users, that are not, distributing drugs. But when you take a look at Portugal, they've done a lot of great things. But at the same time, you have to look at the data where drug abuse in Portugal and drug-related deaths have increased. They've increased, they haven't gone down. And one of the things that I see in terms of decriminalizing drugs is that if there's no legal sanctions, you're going to have individuals that may be tempted to using drugs. The state of Oregon here in the United States legalized drugs in 2021. But like Cristiana says, they push this as a pro-treatment situation. And as a result, they really did not get these people into treatment facilities. And as a result, the pro-treatment issue in Oregon, met with dismal failure. And then you had Colorado. There's a lot of states in the United States that legalized or decriminalized drugs to include the state of New Mexico, but Colorado was one of the first ones. And what happened is they were unable to control the drugs, and that the marijuana that was legalized there started to filter into other states, and other states started to file lawsuits against Colorado because of that. And then what they were doing is marketing a lot of the marijuana to kids. You know, instead of ring pops, they would call it ring pots. Instead of Pop-Tarts, you know, pot tarts.
Okay.
And
I just don't want to confuse, you know, the treatments that they're talking about and of adult addicts with children trying or getting their first exposure to drugs. We'll stay clear of that for now. I do want to move on to Antony, because you're actually somewhat on another extreme end, advocating for decriminalization across the board. And you actually use the state of Oregon as an example. And maybe you can tell us if you believe in what Michael says, because you think it should actually be rolled out across the U.S.
I'm actually arguing that there should be legalized drugs everywhere and regulated drugs. Now, people might hear that and think that sounds crazy, irresponsible, drug use would massively go up. That's obviously the default position, because at the moment in really much of the world, drugs are either illegal or some places have decriminalization, like, say, Portugal. And as Mike said, in parts of the US, there is decriminalization and also legalization, not of all drugs, but of cannabis. And to me, having spent a lot of time in the last 5 years traveling to many countries around the world where the US-backed drug war was the most ferocious, because demand for illicit substances in the West is huge. A lot of people want to take illegal drugs for good reasons or bad reasons. That's the simple reality. And because we've criminalized it in so many places, just last year in the US, 110,000 Americans died of drug overdoses, not just because of fentanyl, but partly. Now, the idea that that is a normal situation, no one on this panel would agree that it is, but that is, to me, the result of decades and decades of not just mismanagement, but a deliberate plan in the US and in other countries too, to actually allow the fact that the drug war actually is not a war on drugs, it's a war on the poor. That's what it principally has always been. And the reason why I and increasing numbers of people around the world argue that the legalization and regulation of all drugs, not because we want everyone to start taking cocaine, in fact, it's the opposite of that. Because in a legalized system, you remove principally the black market, A. B, you give massive amounts of education. The just say no mentality, which was popularized years ago in the US, where Nancy Reagan famously talked about kids should just say no to drugs. Well, frankly, it doesn't work.
No,
it's never
that
worked.
backfired, many argued.
Exactly. So the idea, in fact, in some ways of legalization is huge amounts of education and believing that drugs are not seen as cool. I mean, the fact is, at the moment, for many people, because drugs are illegal, they're seen as somehow illicit and sexy, which clearly is not the case. The idea in a healthy society is drugs should be boring. That's the point. Some people will take drugs, some people will abuse drugs.
But I mean, people who tend to, and I'm going to put it this way, tend to party, they don't think drugs are boring at all. And they think the outcome actually, you know, but here's my point. Are you sure you fully understand the dynamics of the United States? Because it's a country, for example, where, you know, weapons are widely available. And do you think then a free market for cocaine and guns should go safely in hand? Because people are still, if you legalize it, people are going to use it. You can take away the cachet of it being cool if you try and you get that kind of campaign right, but people are going to use it. And in a country like the United States, that could really put society at risk.
I would say in terms of guns in the US, the massive problem with guns is because it's not often regulated well enough. Look, I'm not idealizing the legalized... And it's not going to be.
That's what I'm saying. And that's why I talk about the dynamics specifically of the United States. Is it a kind of... tell me if I'm wrong here, but I see In the case of Portugal, you're looking at a very responsible, in a way, society that shares this collective interest in paying higher taxes and investing in a lot of infrastructure to make sure that these drug addicts and stuff are now well taken care of and treated under a public health care system. You're probably not going to get that out of a country like the US. So if you decriminalize and legalize all drugs, what's going to happen? And you know what?
The issue is not just...
Go ahead.
But the issue is not just legalizing, the issue is regulating. As I said, the issue of regulating all drugs and legalizing is not to make it somehow more widely available. The people who are modeling this and talking about it say in some ways drugs become more difficult to access, not easier to access. For example, the hardest drugs, heroin, cocaine, etc., it's not simply available around the corner. A black market in a legal system is mostly gone. There's no incentive for a black market to exist. I'm not idealizing it. There will still be a black market of sorts. But surely when we talk about imagining a different reality in the future, we have to assess how it's been in the US and other Western countries for the last half century. It has been an absolute catastrophic disaster. Drug use has never been higher. So therefore, surely trying in a regulated, legalized way, and I admit, decriminalisation is where it will begin. It won't suddenly move from where we are now to legalisation, but decriminalisation is a logical, clearly moral, in my view, ethical first step.
Okay. Michael, I saw you shaking your head at one point. I want to get your thoughts then.
Well, I think that it's ludicrous to say that drugs should be legalized, that they should be regulated, because those experiments have been tried around the world. When you take a look at the Netherlands, especially Amsterdam, where they have the infamous coffee houses, and there you can buy 5 grams of hashish or marijuana. And the thing is that drug abuse among school-aged children in that country shot up by 350%. Switzerland had Needle Park, where they basically legalized the use of weapons the use of drugs, heroin and what have you, in that park. And all of a sudden they started to see a huge increase in the addict population in that country. So that is not the answer. You know, if you talk to the vast majority of Americans, know that that is not the solution.
Okay.
Because then what you're going to have is people that are going to be incapable of working, accidents in the workplace, driving up healthcare costs. That experiment has been tried in many countries, and it's met with dismal failure.
Okay, so you're saying there's a whole chain of consequences, other consequences that comes with it. But
absolutely right.
So Anthony, what's wrong with that point?
What's wrong with the point is that essentially the US and other Western countries have been trying what Mike has advocated for over half a century, and it's been a catastrophic disaster. I mean, there's no metric that suggests that what the US and many other Western countries are doing works. There's just no metric that shows that.
Okay, Anthony, but could you use the argument for as bad as it is, it could actually get worse if you look at certain levels of legalization and decriminalization of these drugs?
Well, put it this way. In the states in the US that have legalized cannabis, in many of the states, though not all, obviously no state apart from Oregon has decriminalized all drugs. No state has legalized everything. It doesn't exist, that's true. But the states that have legalized cannabis, in many states, drug use has not gone up. In some places it's gone up, in some places it's gone down.
Let's stay away from cannabis, because now we're talking about the methamphetamines and cocaine, which are kind of in a league of their own, and they are separated by class according to law. So those are the drugs that we're looking at now, and those are the ones that Michael in particular is saying there's going to be a chain of risks involved.
But the argument that essentially seems to be being made is that the status quo somehow is horrific, and the fact that we're empowering the black market to make trillions of dollars is kind of better than the possibility of a different system. That to me is an insane argument. The argument just doesn't bear up to any factual basis, and more importantly, it's killing huge numbers of people. I mean, keep in mind the fact, for all the Westerners that were wanting to get drugs all the time, and I'm not making this as a moral argument because I think people should have the right to take drugs, but there is a hugely destructive chain of misery that is caused for people to be able to get drugs in London, New York, Sydney, wherever it may be. That's the cause of the current war on drugs that exists. It doesn't work.
Okay.
So surely imagining a decriminalised at least system would be a damn good difference to what the reality is today.
Okay. The clock is against us. I'm sorry, Cristiana. I wanted to come back to you because I do want to hear your response to the statistics Michael was quoting. I can't verify those statistics personally, but he was saying that they indicate this similar programs actually backfiring in the Netherlands and Switzerland, for example. Have you seen those reports? Is that true?
Harm reduction teaches a very pragmatic, a very humanistic approach, but essentially a very pragmatic one. And war on drugs has given us incarceration, that's the exclusion of people. So no reality is worse than this one, what we are seeing in the United States or in Canada. Do not decriminalize drugs, put people in a parallel reality. So they cannot access any service because they are doing something that is criminalized. And to implement harm reduction services, for people that defend these services, people need to be alive. First of all, we can implement drug checking, we can implement drug consumption rooms, but if the number of deaths still scale up, if people are still disconnected from these services, we cannot do anything with them. And the other thing I wanted to point is that drug use is a part of society right now. So we are all drug users. We all drink our coffee to wake up. We drink to relax after a long day of work. So we even accept this drug consumption by people who we admire in different areas of society. However, as society, we refuse to accept these same coping strategies when it is taken by people that are poor and in very vulnerable situations. So people who are isolated, have past experience of trauma, need to sleep in the cold while taking risks of being arrested and beaten. So we ignore this numbing effect of psychoactive substances in these situations, for example.
Right. You know what, we're down to our last few minutes. Michael, I just need to get back to you because, you know, not just what Cristiana was saying, there's also an issue about stopping the shame of addiction that has led so many people to go underground and secure highly unsafe, toxic substances. That's in part how decriminalization actually curbs overdoses and saves lives. Do you see no value in that? Is it not worth at least trying to save the people that, as Cristiana was saying, are disproportionately among the poorer classes and do eventually have to go underground, really, to take even greater risk to feed an addiction?
Well, the thing is that, you know, I think that there's a misconception, for example, that the DEA goes after drug users. We go after drug distributors. And the thing is that I don't believe
Right, we're talking about the local, mostly local police forces.
Correct, but the thing is that I don't believe in decriminalizing any drug. And the thing is that it doesn't prevent, for example, here in the United States, for users to seek treatment, even though it's against the law in many states, it doesn't prevent them from seeking treatment. And the other thing that I'm going to have to say is I don't consider what we do here in the United States as a war on drugs. It's more like a permanent campaign against drugs. But I think that education is the key to a lot of this, and educating our kids at a very early age to stay away from illegal drugs.
Right. Those, like, but as Antony was saying, those campaigns are very tricky, and they can backfire. And as the Just Say No campaign back in the 80s.
They can backfire, but they can get a lot worse by legalizing drugs.
Okay, Antony, I can give you the last 30 seconds. Go ahead.
I guess I would say that putting all these issues aside, think about for the last 50 years, psychedelic drugs were deemed dangerous, illegal, and horrible. There is now unbelievable amounts of research happening in the last 5 years from all over the world showing that for many of these drugs, psychedelics, magic mushrooms, LSD, ecstasy, can be unbelievable tools to help with PTSD, trauma, addiction, drugs that were demonized for decades and decades. I'm not evangelical about this. I'm not saying it helps everybody, but I'm saying we are moving towards a world in the coming years where some of these drugs are going to be prescribed by doctors to actually assist people to really make their lives better. And that to me is a profoundly exciting prospect.
We'll have to see if that could ever apply to methamphetamines, though. Okay, Anthony, you're going to have the last word. I'd like to thank all three of my panelists so much for being with us. Unfortunately, we're out of time for this edition of the Newsmakers. Thanks to our viewers as well. Remember to subscribe to our YouTube channel. I'm Andrea Sankey, and we'll see you next time.